In this video, we're going to talk about the vertebrae. We're first going to cover the different vertebral segments, and then we'll talk about the anatomy of each vertebra. There's going to be a future EasyMed video that covers the anatomy of the spinal cord and different dermatomes, so this video will serve as a good starter before we do that one. There are a total of 33 vertebrae, and they can be split up on whether they move or not. There are 24 vertebrae that articulate with each other and they're mobile, they can move. And they include the 7 cervical vertebrae, the 12 thoracic, and the 5 lumbar. And then there are 9 vertebrae that are fused together, they're non-mobile, and they include the 5 sacral vertebrae and the 4 coccyx. The 24 mobile vertebrae make up the superior portion of the vertebral column, also known as the spinal column, and then the 9 fused vertebrae make up the inferior portion of the spinal column. The goal of the vertebrae and the vertebral column is to protect the spinal cord and support the rest of the body. So as we go from the superior to the inferior portion of the vertebral column, we first start off with the cervical vertebrae. These are the vertebrae in the neck, and they help support the head, which weighs about 10 to 12 pounds. There are a total of 7 cervical vertebrae, and they're labeled C1 through C7. As we work our way down, we then move on to the thoracic vertebrae. These are the vertebrae of the mid-upper back, and they help hold the rib cage and protect the heart and lungs. They're less mobile than the cervical and lumbar vertebrae. There are a total of 12 thoracic vertebrae, and they're labeled T1 through T12. Next, we have the lumbar vertebrae, and these are the vertebrae of the lower back. They're much larger in size because they support the rest of the body, and they also help us when we lift heavy things. There are a total of 5 lumbar vertebrae, and they're labeled L1 through L5. So as we said before, the 7 cervical, 12 thoracic, and 5 lumbar vertebrae make up the 24 mobile vertebrae, and there's an easy way to remember how many there are in each of these vertebral segments. Just remember breakfast, lunch, and dinner. For breakfast, you can remember 7 a.m., and this will correlate with the 7 cervical vertebrae. For lunch, 12 p.m., this will correlate with the 12 thoracic vertebrae. And for dinner, 5 p.m., this will help you recall the 5 lumbar vertebrae. Next, we have the 9 vertebrae that are fused together. Remember, we said there's 5 sacral vertebrae and 4 coccyx. Starting with the sacrum, these are 5 fused vertebrae that are labeled S1 through S5, and they connect with the hip bones to form the pelvis. Lastly, we have the coccyx, which is the tailbone, and these are 4 vertebrae that are fused together. There's an intervertebral disc located between each of the mobile vertebrae, with the exception of between C1 and C2. The intervertebral disc forms a cushion between the vertebral bodies so the bones don't rub together. Let's now take a closer look at the disc. There are 2 main components to an intervertebral disc, the annulus and the nucleus, and they actually function opposite of each other. The annulus is made up of fibers that crisscross and help hold the vertebral bodies together, whereas the nucleus is a gel-filled sac that pushes the vertebral bodies away from each other. A fairly common back problem is what's called a herniated disc. This is when the nucleus protrudes through the annulus and compresses on spinal nerves, which can cause quite a bit of back pain. Now that we have a good understanding of the different vertebral segments and the intervertebral discs, we're going to talk about the anatomy of each of the vertebrae. The overall anatomy of each vertebra is fairly similar, with the exception of C1, C2. They have a little bit of a different shape, so we're going to start off by talking about those first. C1 and C2 are the first 2 vertebrae of the spinal column, and they're part of the cervical spine. C1 is also known as the atlas, and C2 is also known as the axis. C1 is shaped more like a ring, and it's located right below the occiput of the skull. This allows us to move our head up and down as if we were saying yes. C2 has a projection coming off of it, known as the dens, also known as the odontoid process. This allows us to move our head right and left as if we are shaking our head no. The rest of the anatomy and features of each vertebra is fairly similar, and we're going to talk about those now. We're going to use several different images to walk through the anatomy of each vertebra. The orientation of the image on the right is with the anterior aspect facing upward and the posterior aspect facing downward. So let's talk about all the anatomical features going from the anterior part to the posterior part. So we're going to start off with the body. This is the weight-bearing portion of each vertebra. And as you work your way down the spinal column, the vertebral body gets larger in size because it needs to support more weight. Remember that there's an intervertebral disc between each of those mobile vertebrae, with the exception of between C1 and C2. As we work our way posteriorly, we get to a hole in the vertebra, and this is known as the vertebral foramen, and it's where the spinal cord travels through. Next, we have the pedicle, and there's one located on each side. This is what connects the vertebral body to the transverse process. Each vertebra has 2 transverse processes that come off the vertebral body and extend posterior and laterally. The transverse processes of the thoracic vertebrae articulate with the ribs. The lamina is what connects the transverse process with the spinous process. Each vertebra has a spinous process located in the posterior aspect of it. Lastly, each vertebra needs to be able to articulate with the vertebra above it and the vertebra below it. and it does so through a couple different articular processes. First, we have the superior articular process, which is located at the superior portion of each vertebra, and it allows for that vertebra to articulate with the vertebra above it or superior to it. Then we have the inferior articular process, and as the name suggests, it's located at the inferior portion of each vertebra, and it allows that vertebra to articulate with the vertebra below it or inferior to it. Let's take a look at a side view of two vertebrae so we can get a better understanding of how the superior and inferior articular processes come together to form a joint. So we can see we have two vertebral bodies, and then we have the pedicle which joins the vertebral body to the transverse process. The superior and inferior articular processes are located where the pedicle and lamina meet. So if we take a look at the vertebra on top, we can see that its inferior articular process is going to articulate with the superior articular process of the vertebra below it. So again, the inferior articular process is located at the inferior portion of the vertebra, and it allows for articulation of the vertebra below it, whereas the superior articular process is located at the superior portion of each vertebra, and it allows for articulation of the vertebra above it. There's one more anatomical feature that's unique to the cervical vertebrae, and that's a foramen that's located on the lateral side of the vertebral body. It's called the transverse foramen, and it allows for passageway of the vertebral artery, vertebral vein, and sympathetic nerves.